Open nice and big for me, okay? So we got a little bit of medicine going here already. Open really big. So to start off with, what we're going to do, the goal is to place an implant in this area and in this area, then one back here in this area, and one back here in this area. To start off with, we're going to get an implant here and here. So this tooth's going to come out. We're going to push this tissue back, get those 2 implants in here first of all. Then we'll take these 3 teeth out over on this side, or 2 teeth left out on this side. Make sure we can find that nerve and then place an implant on an angle like this. And then once we have that in, then we'll come back over here. Open nice and big for me there, bud. Open. Get these fellas out, and the same thing over here. So, let's go ahead and give some medicine. Get you. Get the gauze right in there. Because you get bleeding that you can't suction, and it kind of gets away, and then it sneaks on the back of the bite block, leads to coughing that you don't want. So, I find it helpful. Let's get this tooth out. This isn't going to take much. There we go.
Oh, I wanted to do that.
All right, I'll get 15 bite.
What's that?
15 bite.
Weird if I grab it.
You're going to have to do some alveoloplasty in here, obviously. Come on now. Alright, sorry about that, Charles. I gave you the elbow. Okay, now we're just going to raise a flap here. Yeah. Suction right here.
Hey, Chris, will you push the blood pressure?
Thank you.
Thank you. Down there, push start. Start on. Yep. Thank you. There it goes.
What's it beeping about? Do we know what?
The apnea.
Is the CO2 not hooked up?
It's hooked up. It's just not a... You can see he's got condensation in the line.
I know it's... Maybe it was just Kate. Guess I can hear that one good.
Yeah, you can see it bouncing up in the bottom.
So this is where that loose tooth was. This is all just inflammatory tissue that's got to go. Let's actually work this up here. That's where that really, really loose tooth was that I just lifted out. Let's get a curette or a rongeur. Let's put a rongeur first. Easier. So grab onto this soft tissue and just start getting some of that out. Okay, curette. And some fluid on it. Rongeur back again. A little bit more soft tissue right there. Okay, good. Alright, I'm going to need a pilot drill on an extender now. In the meantime, I'll take a periosteal. Excuse me, Mr. Cameraman. So the next thing I want to see, there it is. There's a nerve going in, right there. That's the nerve going into the jaw right there. So now we know where that is. We're going to respect that a lot. Okay.
What size are we going for?
4 3x13s all the way around. Okay. So, pilot drill on an extender, please. Now, I find that with this, the lingual plate is like a nice stable piece of anatomy to kind of figure out angles. And then here, and not in reverse. Works better in forward than reverse. Okay. Super dense bone. It's impressive. Definitely dense bone protocol.
Okay.
Definitely dense bone protocol. So that is solid as a rock. There we go. We're at 13. Okay, a little more water there. Okay. That's good there. Let's go here now. Periosteal. I'm going to prepare this site just a touch more. This soft tissue just out of the way a little bit so I can see a bit better. Lingual plate. I want to make sure that there's no granulation tissue. Rongeur. I want to make sure there's no granulation tissue. Rongeur. Right in the way. Raw here.
That's not a rongeur. Rongeur, right here.
Raw here, rongeur.
Changing up the back there.
Okay, there was a little granulation tissue there, but not anymore. So I got this angle right here that I like. I'm going to go just a little bit beyond too. I know there's no anatomy to worry about below. If I go a little bit beyond, it gives me some wiggle room. Okay. So dense bone protocol for 4 3x13s right in that area, please. You have a pretty good view there?
Yeah, that's a really good view.
Okay. Alright, some irrigation.
Okay, you want to come and stay behind Heather? Behind me?
Is that alright?
Yeah. Yeah.
You know, she come right here and now you can take a look.
Yeah, and
Ooh, nice
lower.
this.
So you'll saving you this time. Be able to feel it.
Sure, why not?
I don't know if you're saying anything.
So you can see,
Kind of.
you can see like where I started the 2 implant sites next to those 2 teeth. This is when 1 tooth came out. There's a lot of granulation tissue. That was a little blob of like soft tissue that was removed because that tooth had no. It was not in bone at all. It was completely in soft tissue. That's why I could just flick it out with my fingers. Okay. Do you want to save that bone or
Yeah.
I'll go to the other side?
Stand there, you might get
Yeah, I don't want to be in the sweat zone.
Thank you.
Just gonna leave that in there.
It's always fun. An extra bonus. Have to charge him extra though if he leaves with the drills. That's a joke. Save that and I'll need it back. I don't need that one back now at this point. Do you have an ash? Yes, you do. No, just checking. Close though. this the final drill, or?
Nope, yeah, oh, I'll set it in parentheses if you like.
This is parentheses?
Nope, that's 6, and
Okay.
the next one's in parentheses if you like it.
So I'm going to do it this one, because I really need primary stability. I'm going to go down to almost depth. So I'm going to under-prepare just a touch. Just to really make sure that these implants go in strong.
7 on that?
No, I do not. And then I'll go ahead and
And for the implant?
do it. Yeah. Implante. Again, we want to make sure that there's any soft tissue that's going to go down in there. They canceled the annual meeting.
Oh, they did?
Yeah. It's going to be all virtual. That's what they said.
Oh, interesting. You want the long
Hear
driver
it.
to grab that?
Yeah, the long driver. Yeah.
So, what number is this one for?
Well, we can do 23 and 26. So first one, how about 26? Put this on, and then I'll wiggle it until it pops down. Okay, and then when I take it off, I always put it over here too. So if it drops, it doesn't just fall right on the floor. You noticing? Okay, I'll get the hand wrench. And then yeah, I'll need the next implant. This is where we might actually have. Oh, you also got to always check these things, make sure the wrench is together, right?
Can I get another implant? Yep. Okay.
Yeah, that neighboring tooth is almost interfering. So I could always take it out if I need to. Put instruction right down the front. Okay. It is interfering, kind of an ash. So now, this tooth is in the way. It served its purpose, so it's going to go away now. Okay. I'll take that driver on the wrench again, please. Yeah. Okay, yeah, I think I can make that work.
If not, I'll give you the long, but I'm...
Because this needs to be down just a twist more. Just a touch more. Excellent. Next one. Another river. Another implant. These are 4.3 by 13 Noble Active implants. I'll put the long driver. Okay. Fantastic primary stability because we're going to load these things right away. We're going to put temporary teeth on these bad boys. Okay. Now I'll get an ash back again. So we got one more tooth that needs to go over here. You guys all have such steady hands. I had like a Perioso. We had like a repair guy out at our house helping with the pool because that thing's beyond me. But anyways, and he just didn't have steady hands like you guys all do, and you get used to like just like really like rock steady hands, and all of a sudden you're like, oh, it's not so much.
Yeah.
Sure.
At least he's not doing surgery.
No, he's way better at what he did than what I. Yeah, I mean he was good. I was glad to have him there. I didn't say anything.
What's going on with your pool?
So the chlorine pump wasn't pumping, and so I fixed it in air quotes, and then it still didn't work. And then they came out and they're like, oh, that actually never happens except for this time. Yeah, can I get a favorite burr?
Sure.
And then a Selden. So then I got you need this piece now. I'm like, oh well. You never mentioned that piece, and neither did YouTube, by the way. Can I get? And sure enough, once you have the right piece, put it together. Well, jury's still out, but I think it works. In the meantime, I almost blew up the chlorine tank. There's a tank of chlorine back there, 16 gallons of chlorine, and the barrel was bulging. It almost looked like it was gonna explode.
Oh wow.
Yeah.
That is a long burr. Oh wow. They have. I don't know why they put long.
This is fairly aggressive approach burr, so you just have to be judicious with it and be kind to it. This bone is nice, but it's kind of sticking up. And the transition from back here, where this implant is, His ear is not very smooth, but it's about to be smoother because of this handy little fella. And I don't even have this thing at full RPM, not even close. It doesn't scratch around at all. Just save all that. There's some good bone, show them that on camera. This is some really good bone from the actual procedure. And then just, yeah, go ahead.
%70 overall drop in opioid use. And with the proper understanding and use of Exparel, you too can see the success that Exparel will bring to your clinic. Dr. McClelland, DDS, has been using it in his clinic for a few years now, and he's seen great success in his patients and their pain management every day. In this 6-video series, you get a professional masterclass that will give you the jump start you need to include Exparel in your daily routine. It includes a bonus PDF with a patient information handout, post-op medical instructions, and a quick look sheet for the materials and supplies for explaining Exparel. Go to teachable.com today and get educated on a non-opioid anesthetic that will help your patients have a better day.